In small rural hospitals, often the bag valve mask device is placed in locations which is inaccessible. Very often, baby bags or 250, 450 or 750 ml bags are the only bags available for children. They are not washed after every use. Parts of it, especially the reservoir, may be missing.
In this video, let us discuss why we need to choose the largest size bag valve mask for the PREM unit and disable the pop-off valve, and also how we clean and check out the bag valve mask on a day-to-day basis. Part 1. The size. Many sizes are available. The 250 ml bag is used for preterm babies, 450 to 750 ml is used for term babies. For children more than 1 month, the PREM guidelines recommend the use of the adult size bag, that is 1000 ml or 1 liter bag, for adequate chest rise. The reasons are as follows. Infants more than 1 month who are rushed unresponsive to our hospitals without pre-hospital resuscitation present with cardiorespiratory failure. These children have primarily become unresponsive due to the lung pathology such as bronchiolitis or pneumonia or acute lung injury due to severe sepsis. Heart is also failing, causing cardiogenic pulmonary edema. Ventilating such bad lungs, non-compliant lungs, requires the largest bag, that is the 1000 ml bag, to provide adequate chest rise. The pop-off valve or the pressure release valve is a safety valve for the neonate that pops off at 40 centimeters water pressure to prevent barotrauma-induced pneumothorax. We need to give higher pressures and the pop-off valve has to be disabled. However, we need to choose the right mask to fit the infant or child. Use a larger size bag, but use a mask that fits between the bridge of nose and chin. Part 2. How do we clean and check the bag valve mask device after every use? Step 1. Check the device for damage. Step 2. Disassemble or separate the parts. Remove the mask, unscrew the non-rebreathing valve. Remove the reservoir, unscrew the inlet reservoir valve. Wash each part with soap and water. Immerse all parts in Sidex for 60 minutes. Wash with clean running tap water. Dry the parts. Reassemble the parts as shown in the video. Connect oxygen, occlude the mask end and check for filling of reservoir. Compress the bag and check for self-inflation of the bag valve mask device. Place bag valve mask at the head end of the resuscitation trolley or warmer.
A properly maintained and cleaned bag valve mask device in small rural hospitals can help reduce the impact of hypoxia on the growing brain.